whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we're talking to Vincci Wilson, the Vice President of Development at Northwest, a global leader in healthcare property development and management. She just finished recently the Jerry Coughlin Health and Wellness Center, which was a humongous 67,000 square foot medical building, complete with an urgent care, operating theaters, pharmacies, clinical space, and several other medical and health services. Vincci, thanks so much for joining us today to chat about how these projects come to life.
Thank you for having me. Really happy to be here.
So a project of this scope, I mean, these are gigantic. There are not a lot of, buildings of this size privately built across the country here. What was Northwest's role in bringing this whole thing to life?
So I'll go back to the sponsor, which was the healthcare operator, the hospital operator being Lake Ridge Health. They put out a RFQ, which is a request for qualification and a request for proposal in order to solicit the public in terms of helping them to build this medical office ambulatory surgical center. And so Northwest responded to these and was selected as the preferred proponent. As a result, we were collaborating with the hospital in order to design, build, fund, and manage the site for Lake Ridge Health. So on this particular project, Lake Ridge Health owned the land. And so Northwest Healthcare is a tenant on the ground lease, but the building itself is owned, operated, and built by Northwest, with Lake Ridge Health leasing out their portion of the building, being 50% of the building. So Northwest really was the development manager throughout this whole process. And we helped the hospital put together this 67,000 square foot surgical building where the third floor actually operates 4 operating rooms with 5 recovery rooms. And they provide non-acute elective surgeries such as hips, knees, cataracts, and reproductive health procedures. All non-overnight stays, and we then are able to lease out the ground and second floor to the market tenants, co-tenancies that we deem complement Lake Ridge Health as the anchor user.
Very cool. And then what was your role within this whole project?
So as the VP of development, I oversaw the construction of this project. I've been with the company 3 years, and so having this been completed in 2023, when I joined the company, we were about 75% of the way through construction, which, as you can imagine, the last 25% is almost as long as the first 75%. So we constructed this during COVID. We actually tendered and awarded this project prior to COVID. And when it struck, it really impacted the construction and the collaboration between our external consultant teams. So some of the challenges of constructing through COVID, as you can imagine, are, time and space separation, actually having certain crews being sick with COVID, and having to manage logistics in a non-sequential way because of COVID. And so we have learned a lot through this process. Unfortunately, a lot of the outcome of constructing through COVID was a slightly longer duration.
Okay, fair enough. Well, I'm thinking that must be very difficult to, again, it was this unprecedented global event that had taken place. That must, be very difficult in terms of how do you build a building and try and keep these public health measures, and everybody's wearing a mask while they're hauling around big loads of materials, driving machines around.
Absolutely. And when certain crews are sick with COVID, for instance, our entire elevator crew was sick at the same time. And so instead of having sequentially the elevator come in and then put the floors down, we had to allow the flooring trade to come in and install the floors. And then afterwards, we had to protect the floor in terms of weight and movement in order to accommodate the elevator being put in afterwards. Similarly, we had timing issues with the generator, where we originally thought that we could put in the generator before we closed the roof. We had to keep an opening in the roof and protect the whole building while waiting for the generator to arrive. So a lot of logistic gymnastics had to be done in order to accommodate a less than ideal time frame for construction.
Yeah, no doubt. Well, I guess like that probably threw all the different timelines for procurement and deliveries and just getting all these different parts of the project to line up on time with each other. That probably threw a huge wrench into the mix.
It did, but I will give credit to our partner and the operator here, which is Lake Ridge Health, because they were extremely understanding. And throughout the process, knowing that they were the anchor tenant and taking 2 floors of the building, they are a significant portion of the building. And our base building needed to accommodate all of their users, programming, equipment, in order to allow them to function. And so having them at the table at every meeting was incredibly helpful, and it helped keep morale up, both with the construction group and the consultant teams.
And how long does this whole project take? Like all the way from when the RFP gets posted through to the planning, the design, and breaking ground, and then actually calling it done?
Well, in this case, we were just over 36 months from start to finish.
Wow.
But a lot of the time is at the front end on the design and planning side and getting the approvals. And so on the construction side, that was just under 2 years, 22 months. But it was the front end work that really took the time. And again, having a collaborative team works. Unfortunately, with COVID, where we couldn't physically meet in person and our consultant teams couldn't collaborate in person, you can imagine trying to navigate a set of plans on Zoom and using your mouse to point where this shaft needed to be larger to accommodate more HVAC. It's very difficult to do so. And ultimately, unfortunately, on site, that ended up being points of tension between the construction group and our consultant group, because a lot of the time, if you've had the in-person collaboration and conflict identification on plans ahead of time, you can alleviate some of the on-site conditions. But unfortunately, we didn't have as much of that as we otherwise should have. And so a lot of that needed to be on-site, in situ, collaborative conflict resolutions and design resolutions that, we otherwise wouldn't have encountered.
I can imagine things like that pop up on occasion. Is there like an industry standard for, let's say you add 10% to your anticipated delivery date time frame, and then that's what you tell to the client? Or like, is it just, you obviously want to minimize all these delays, but like how much delays on a 3-year project is acceptable?
I think it really depends on the tenant and who we're building it for. So Lake Ridge Health had a little bit of buffer in terms of an end date. And because we worked hand in hand from day one, they understood the challenges that were encountered on site. And so they were gracious enough to give us the extra time to figure it out. Whereas in some cases, if we have a deadline and we must meet it, not to say that we can jam it through, but a lot of the time it really comes down to, okay, if it has to be done by Friday, we have to meet Monday and go on site and jam it through. Everybody who's involved needs to be there, and we just have a whole session. We did do that on this project, but it was limited to the number of people we could have on site at any given time. And, a lot of times it's a very specific design and construction related matter. For instance, a window not sitting properly on a ledge. It doesn't help if 30 people are on site to try and resolve this issue. This is really a constructor and glass manufacturer who is in China needing to resolve this. So, not every problem can be resolved in the same way. And so it was navigating all those different types of problems that come up on a typical construction site, but with the constraint of COVID and physical separation that was required.
This podcast was brought to you by Cherry Health, the healthcare jobs network with over 35,000 jobs across Canada and the US. Physicians, nurses, pharmacists, and all other healthcare professionals can sign up for free. Start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across North America. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum, with thousands of new jobs posted every week. www.cherry.health to get connected today. I guess while we're on the subject, kind of the interesting bits, did anything else just go wrong or take a serious turn for the worse on the project that you thought was interestingly handled?
It's funny you mentioned that, because that summer, I want to say the summer of 2002, in Ontario, we had a full labor strike. Most, if not all, trades were on strike for higher wages.
Okay, yeah, that'll throw a wrench in the mix.
Understandable. And so it impacted us directly because of the construction contract that we had already tendered and awarded. And so any overtime hours would be subject to this new rate, first and foremost. And second, the labor strike itself was weeks for some trades and up to, 6 weeks, like over a month for other trades. And so it was a waterfall effect in terms of who could be on site at any given time because of their strike schedule and then resolution timing. So just because you resolve something doesn't mean that it is resolved across the board. Every trade union has their own negotiations. And so we were subject to all of those pauses in work, as well as labor, wage, negotiation, resolutions.
Oh, goodness. And then the RFPs, like how these work is you get awarded the contract and then whatever profit is left over, the developer gets to keep, right? So if there's a strike and a wage raise in the middle there, like that directly, you might even be in the red at the end then, right?
Absolutely. Absolutely. And so that's part of the risk that gets mitigated if you go with a, let's call it we're a private developer, but really we're a publicly traded entity, is that the developer takes on that risk, right? So whatever rental rate we negotiated with the hospital operator, in this case, Lakeridge Health, it is in their lease for 30 years. It's already pre-negotiated. And so any overage is a direct impact on the developer, because that, let's call it the lift, is eroded by the situation.
And then if we back up kind of to the start, so an RFP comes out, walk us through how a project like this just comes to life. Like, what are even the first steps of, okay, we've got some specifications, we know what the first tenants are going to look like coming from Lakeridge Health, then what?
So when a hospital operator goes out for RFQ, it's open to everyone and anyone. You and I could form a little team and respond, but really it comes down to our qualification. Can we get it done? Do we have not only the capacity, but the financial capacity to fund it and get it done? So that's first round. You can get eliminated at first round. Second round is the RFP, which asks a little more of the development manager to come up with a design that ultimately has to be reviewed and approved by Lakeridge Health. So here you bring in your entire consultant team, you come up with a design, you cost it out, you bring on a construction manager to make sure that it's constructible, in the most efficient way possible, understanding all the trends in construction costs, understanding where the logistics, where your materials are coming from and whether or not you can get it into Canada, and understanding all of your trade and trade partners and what their interests are. I think just a side tangent is really the value that a developer partner brings to the table is having those relationships. Because like I said, you and I can form a team and try and build something on our own, but really it's about leveraging our relationships. Because if we don't pick the right trade with the right crew, we could be in for some serious change orders and budget overages that we otherwise weren't anticipating. Similarly, if we're not tracking where materials are coming from, we could be held up by, you know what, I sourced glass from China that is way cheaper, but the lead time is 19 weeks versus I could source it domestically and it's a little more expensive, but I could get it here in 2 weeks, right? If you don't understand all the history and all of the supply chain issues that impact construction, you could easily make a decision based on cost and not understand the impact on total project viability at the end of the day. Back to your original question about how this comes about, finding or responding to the RFP is incredibly important. Making sure that you can actually execute on what you've designed is incredibly important. And that relies on having a team that actually can do things that you know for a fact with experience can execute on your vision. Secondly, it's about understanding the market in which you're operating in. And so we have in-house leasing, which we rely heavily on to tell us what the market trends are doing, what the primary, secondary, tertiary markets are doing in this area. The proximity to the hospital, understanding what that hospital core competencies are in order to have the right co-tenancies in this building. And Lakeridge Health is known for having community-based facilities, first and foremost. They don't operate in just one location. They already had 8 other locations. And so in their business model, it was already known that they would have multiple facilities in order to provide access to all of the areas within Durham region, which is far-reaching and fast-growing. And so understanding what Lakeridge Health needs were and working with the exact people from Lakeridge Health on the clinical side, on the operations side, property management side was incredibly important to get this designed in the right way. So I just want to clarify the scope that we were brought in on is what we call base building. It is not the same as finishing up an entire building turnkey, meaning you can just walk in and operate. It's not the same because we don't necessarily know the exact equipment, logistics, access, and movement of a particular tenant. But what we do is ensure that all their needs can be met by our base building. So if we know for a fact that Lakeridge Health will be providing surgical and operating rooms in here to provide surgical procedures, we have to make sure that their HVAC equipment can be accommodated in the building. How do we do that? We work with their mechanical, their electrical, their architect teams to understand their needs so we can design the base building to accommodate. The generator that is in the building is specific to their use because they need it for their surgical suites. We have our own HVAC equipment, and it's all delineated to ensure that everyone is able to have their capacities met. So it's having the right partner ultimately that really gets you through a project.
That's interesting. So you have your first tenant, like as you'd say, I guess, lined up. They say, okay, we want the penthouse. We're going to take floors 4 and 3 for our surgical suites and urgent care. And then beyond that, then at some point, there's just a handover to the next team who manages like the subleases almost for the smaller businesses that go in there. But you've got kind of that main plumbing and everything sorted out at the highest level that's going to meet the needs of maybe the sophisticated tenant, I suppose, or the one with the most like in-depth requirements.
Yes. Yes, we have to make sure that the building can accommodate from the most sophisticated to the most less sophisticated tenants, meaning they don't require as much plumbing or power to operate their facility or their practice. So a physiotherapist, for instance, is completely different than a dentist, right? The dental unit requires the plumbing. Every room in the dental office requires plumbing versus the physiotherapist office, which might need a little bit more air change, but not as much plumbing. And so what we do in our net new buildings are we offer individually monitored panels for both electricity and water. They're all separately metered so that you're not sharing in the heaviest users' fees.
And so everything comes together in kind of this like magical orchestral symphony of different components. I'm starting to understand why the planning phase takes as much of the time as it does for the whole project. How big is even that initial team when you're trying to, like, okay, we get awarded the contract, or I guess you'd probably even do it before you get awarded the contract. You have to have a lot thought out and planned before they even award the contract. What is the size of that team in terms of the design, the planning, the function, the procurement, the costing it all out, and like putting together a feasible plan?
I would say it takes almost 30 to 40 people on the
Oh,
team
wow.
to get it started. There are multiple consultants that need to be retained right off the bat. So an architect, structural, mechanical, electrical, landscape, civil, your construction partner or your contractor, and then throughout with municipal approvals, you need additional consultants. So wind, you need acoustic. So things that you don't normally think about when you think about a building, all those consultants are required at the front end to make sure that the end result is functional. We also had, an interior decorator, but also it was more for functionality and flow, wayfinding, a wayfinding consultant, really, to tell us, if you wanted to get in and out, what is the quickest way in and out? What is the size of font, the color, what is most appropriate for accessibility? We had an accessibility consultant. We had a sustainability consultant. We had to make sure that we're building this building as flexible as possible so that we can respond to the future trends of healthcare. It's very hard to retrofit something if your building can't accommodate it in the first place. It sounds a little bit like, well, how do you know what to build? And that is one of the most challenging questions that we deal with in development and really in construction, because once it's done, it's done. But it all comes down to design and having the right team understand the healthcare trends. And so we were extremely selective in procuring this consultant team, making sure that the architect that we used specialized in healthcare and hospitals, to know that they are participating in creating the future of healthcare, right? So they are going to the conferences, understanding the new technologies that are being brought forward in healthcare, and so they can design a building that can maybe accommodate it in the future.
It's gonna hurt when you don't win the RFP. Like I get bummed out when I spend a week on a grant project and then we don't get awarded it. But when you've got like 40 people, that's gotta cost millions of dollars almost just in that initial like rolling the dice on getting the project.
Jordan, that is a huge risk, but one that is calculated and one that all the consultants understand is a distinct possibility. So when they join a team, they also vet us, right? To make sure that we are the right partner to respond to the RFP. Because if it were just you and I calling up an architect, they may say, well, what's your background? What's your experience? I don't want to go with someone who can't execute. So their reputation is on the line too. And so that being said, a lot of the consultants have internally managed like a corporate budget to go after new pursuits, understanding that there is a 50-50 shot. If you get to the last round, a 1 in 3 chance that you'll make it and 2/3 chance you don't. So you really kind of roll the dice on that. But again, people matter, teams matter. And so picking the right team and joining the right team is incredibly important.
So let's say you get awarded the contract. How big does the team balloon at that point when it's now execution time?
Well, then you're looping in legal, right? And the whole construction team is, in-house is probably 10 people, and then all the trades. So at any given time on the site, you could have up to 75 people on site working all at once. And then consultants, they bring in other aspects of their team called construction administration. And so it's not the design team, it's the construction administration team that gets involved. And that's a larger spectrum of expertise that is able to interpret a design into the physicality of the building to ensure that what is designed is actually being built. And so that at that point, that team, expands to almost 200 people, really.
Very quickly starts growing. Holy smokes.
Yes.
Okay. Can you tell us a little bit more about the process there? Like, I'm trying to think of it from the perspective of the physiotherapist clinic, considering doing it on their own, or the community medical office thinking about doing it on their side. Like, there's got to be just a ton of background and research and the legal side of things and the codes that go into this. How do you actually go about approaching making sure you're compliant with everything when you don't necessarily know who those tenants are all going to be?
So if I answer this question from the tenant side, again, I would look at the team. Do they have the experience? Do they have the prior knowledge from other jurisdictions, including the one they're going to be operating in, to understand those codes, right? Because those codes are specific to the location in which you are building. And so codes that are, valid in Ontario are not valid in Alberta, and vice versa. A lot of them are universal, but again, it depends on the consultant team that you're hiring. So if I were a tenant looking to go into a brand new building, I'm looking to see if the right co-tenancies are in place, right? I want a synergistic workplace, one that will refer clients to me and vice versa. Second, I would, again, relying on the developer, ensure that all the codes are being met for the building that I want to be in. And thirdly, I would look at the actual building itself. So being structurally, sustainably, is it a place I want to operate my business for the foreseeable future? Because sometimes when you open a practice, you tell me you're a physician, you want a place that you can tell, you want a place where your clients, patients know where to go from now and forever. So for today, for the patient you are serving and for their kids, you want an address that you are proud of and is easy to get into and is in a building that is well maintained, well built, and hopefully sustainable in terms of having the right airflow, air changes, windows, window to wall ratio, and the right atmosphere, temperature, light. Biophilic design, which is just a fancy way of saying that you want a little bit of nature within the building, right? And it all comes down to the design and the execution by the developer.
You got to make it feel like a home. I mean, people are arguably
Yes.
going to spend more of their waking hours here than they will in their actual home.
And don't forget, the people coming through are sick, right? And so they want to feel like they are healing on more than one level. And I think that this term that I used, biophilic design, is slowly making its way into the healthcare space. It was originally introduced in office assets because you are spending most of your time in this type of building, but now it's making its way to healthcare. Despite a short visit, you want to feel like you are healing both mentally and physically.
It makes a big difference. Like, I'm just like, I don't know. I've worked in some pretty crusty medical clinics, and the difference in just the energy versus when you walk into the University of Alberta hospital to start your day, and you get this gigantic expansive atrium with the pedways going everywhere. It really changes how you feel and probably your mood and your energy levels.
Absolutely. And we take that seriously, although sometimes it's hard to um, navigate both the cost and the reward for it, right? The return on investment is difficult to measure, especially when it comes to nature and biophilic design. You don't get a direct sort of impact, although it brings a smile to your face, but how do you measure that?
What do you have to consider in terms of just like allergies and things that go into the building? Like, if you want to have nature and trees or plants, like, what percent of the population is going to have a bad reaction to those things?
Well, I'll give you an example. In our Edmonton portfolio, we have a building, it's called Mira, and there are actually trees inside the building. The building was built around existing trees,
Oh,
and
cool.
we have honored it by creating or keeping the soil volumes intact and creating and pouring the floors around it with a grate to make sure that those trees can continue to thrive. So, not to say that a building should have a tree in it, but even the placement of windows, the size of windows, the amount of sunlight it can attract based on its geographical location makes a difference. Fresh air makes a difference. Bringing in plants makes a difference. Having a living wall in your lobby, maybe with some water, makes a difference, right? Not to say that every room needs to be surrounded by forest and plants, but you could do little things that bring a little fresh air into your space that otherwise weren't accounted for if you were to look at a typical office building.
Oh, definitely. Especially like just the healthcare being healthcare, right? Part of the occupational hazards we face is burnout and mental health challenges. It's just built into the background. We all know this when we sign up, and that's the reality of it. But maybe having a living wall in there probably does help with that.
It's a subconscious thing.
What's the lifespan of a building, anyways? Like, how long would you plan to be in there in terms of that sustainable future?
That's a really good question, because the more that we have purchased and or built, the more we understand that that's kind of a moving target. So typically, I would say a building can last about approximately 50 years. But I think with better maintenance and smarter systems and a more technologically plugged in building, you are able to monitor and react and kind of be proactive in your maintenance than you otherwise would have in a building that doesn't have those smart features. So again, I think it's a living target. You've seen heritage buildings. I personally live in a building in a house that's 140 years old. So it can stand the test of time. It's just a matter of how did you maintain it leading up to it. So it's a good question, but it's also not something that I can answer hard and fast.
So, space is built, everything's coming together. You have your initial tenants set in there, and then at this point, now it's the handoff. Now we're starting to bring in those subleases. Individual smaller businesses are starting to take up those spaces and renovate. But what is the draw for them? Why are they coming to Northwest versus doing it on their own?
I think the value add that we provide and the value proposition is the built-in co-tenancies that will exist or existing already, because we've already curated the right tenant mix in there. And we have a very strong leasing team that advises on the market viability and the market depth of those existing tenants. So we can map out, for instance, if you're a physiotherapist, we can map out where the other physiotherapists are located so that you don't cannibalize and or become redundant in the area that you want to serve. So I think at a Northwest building, you can almost guarantee that it's a turnkey experience for you. It's a plug and play where you already know that there are certain expected tenancies in there. And so you can get the referrals that a family physician would otherwise provide right in the same building. And it's just convenient. We want to be the one-stop shop for healthcare, really, and get you in and out as quickly as possible because no one wants to go to the doctor. We want to get you in easily. Surface parking if we can, top level of the underground parking, easily signed, well lit, well maintained, clean, safe. We want to make sure that experience is top notch. And so I think if you were just going to start a practice and you just decided to go in an unenclosed shopping center strip mall, you're going to need a lot of upfront work in terms of marketing and advertising to get people to find you. But if you come into a Northwest building, you already know that an existing medical campus, let's call it, exists. And you can rely on those networks to start yourself off quickly.
It makes a lot of sense. You just have all of the services there. I remember that there was sort of this concept in terms of commercial real estate development. And it was like this paradoxical, like, why do you have an intersection with 4 gas stations on each corner? Theoretically, they're like competing with each other almost. But when you think of it, like it aggregates people. And especially for the allied health, the physios, the dental clinics, the registered massage therapists, everybody who's not a doctor who has to do client acquisition and that marketing, you really get like just the bundle of healthcare properties all together. And that probably makes it a lot smoother and a lot more turnkey to get going.
Yeah,
like we're privileged. We just like have everybody. We're like the medical world. We're just infinite patient demand. So this is never a problem for us. But for every other healthcare professional out there, it's still like you got a business to run. You have to like have people coming in and using your services.
Yeah, and managing real estate is different than managing a practice, right? And we want to help in terms of leveraging our level of expertise in managing real estate with property management, facilities management, leasing, building operations, construction even. We have that all in-house. And so it allows all of our tenants to just operate their own business at the highest capacity they can. And so it really leaves the real estate to us and the physicians to just manage their own practices.
Is this style, like the larger conglomerate, becoming more and more common? Because I know in the medical space, like the doctor world, the smaller individual, like one physician clinics are just going the way of the dodo. It's just becoming so much less feasible to do things at smaller scale. Is this like really part of the driver for why these mega buildings are now becoming the go-to?
I think we see both. We still see solo practitioners, though they are dwindling, but we have a lot of space. We have units that are specifically catered to solo practitioners, in around 500 square feet even, and spaces for conglomerates, as you say, groups of physicians who have multiple practices, multiple physicians practicing in one unit, up to 8 physicians in one clinic. So we have existing space that ranges from 500 square feet up to 6,000 square feet that you can take in our existing portfolio today. So if there's any interest in leasing up a space at a Northwest property, we've got spaces across Canada, and they range from 500 to 6,000 square feet.
What's the turnaround time from like I'm interested to I can start seeing patients?
On average, I would say it can be as quick as a few months if you can negotiate a lease quickly, up to a year. If it is pre-construction, so what I specialize in is net new construction. And so a lease of that type can be signed as early as 2, maybe 3 years ahead of time. And that is because depending on when you sign the lease. So Northwest as a developer, we don't construct inventory. We purpose build every facility. And so it is meticulously planned with the users in mind, specific users, right? In the same way that Jerry Coughlin was designed for Lake Ridge Health first and foremost, even the ground and second floor are designed for the tenants that we envision and seek after the fact. And so it's less about just building inventory. We know who we want to target and how many of those users we want in any particular building.
One final question then, I guess. What's the next project you guys are working on? What's coming up for the future here?
Well, we want to do more of the Jerry Coughlin health and wellness types. We want to do more medical office with ambulatory surgical capacities. We understand and have been following the need for hospitals to decant their services into community-based facilities. And so we want to help on the real estate side. We want to do more of those, and we want to collaborate more with hospitals. That's where we see the future going.
Okay, well, hopefully some more of those RFPs come through without too much risk. Vincci Wilson, thank you so much for joining us. It was really enlightening in terms of how we all get into these buildings where we do our patient care. Appreciate you taking the time today.
Thank you so much for having me. It was a pleasure to chat.
Thank you for joining us this week on Leaders in Healthcare. If you enjoyed this episode, please like, subscribe, or leave a comment. And if you found this episode helpful, don't forget to share it with your network.